Hey guys, it's your Fit Doc, aka Kristen Small, and I'm back with another banger. So in this video, I'm talking with the class. I'm speaking with the class today, a pharmacy class, I believe, and they kind of just reached out to me. The pharmacist reached out to me. Shout out to Dr. Young. I appreciate her. She is a pharmacist in Chicago, and she reached out to me because she wanted me to talk about my experience as a pharm tech, specifically in the hospital. And she just wanted to talk about my journey throughout med school and just to help motivate someone else about, wherever they are wanting to go in life, whether it is to be a pharmacist, whether it's to be a doctor or a nurse, or just remain a pharm tech. They wanted me to talk about that and my experience. So make sure to stick around for this video and hopefully you learn something. Before I get into this video though, please give me a thumbs up. Give me a thumbs up, you guys. Like the video. Let me know what you thought about the video. Subscribe to my channel. It costs you nothing, but it helps me out so much. I appreciate it. Subscribe, like, let me know what you thought. Comment, say hey, even if it's just to say hey. Just say hey. So let's just hop onto this video. So in the beginning, I didn't record all of it because it was about an hour and a half long, but I was just talking about my journey as a tech and the different types of settings that I've worked in as a tech. And then she just introduced me. Dr. Young introduced me. She works in Chicago. She is a pharmacist. And so she was just talking to me and just asking me some questions about my experience. And I just introduced myself because I was in a group of about 18, 19 people, I believe. And so that's basically what I was doing. And then I also gave some scenarios. So I gave some different scenarios that I've actually encountered personally at my job. And I was just asking the students, what would you do? What's the right thing to do? This and that. So I didn't capture the first scenario on scene or on the camera. But I want to go ahead and just talk it out so you guys can know what it is I'm talking about. So scenario number one was one of your teammates is reconstituting a drug, and you notice that they are not being sterile. They lose control of their needle and it contacts the counter. They continue to use the same needle to puncture a critical site. What do you do? So whenever you're reconstituting a drug, that means you are adding sterile water, you're adding a liquid or a normal saline to a vial of a antibiotic, of an antibacterial medication, or antifungal, antiviral, whatever it is, you are adding it to a vial. Typically the vials are in powder form, so you have to add water to it in order to make it in liquid form, or any type of liquid, not just water. You can add a normal saline or just it depends on whatever the directions are to do that. But you add it to the vial, you shake it up. Sometimes you don't shake it. Some medications you cannot shake. Some you have to just let it sit and let it just dissolve slowly. Some you have to shake very hard. Some you have to just let it sit on a mixer for about 30 minutes in order for it to finish. Nafcillin is one of those things. Well, if you're a pharm tech, you know what I'm talking about. But that's neither here nor there. So some medications, that's how you recon. You add liquid to make it into a liquid form in order to make it usable for the patient. That's what reconstitution means. So if one of your patients is reconstituting a drug, you notice that they're not being sterile. Of course, I work in a sterile environment. I work in a hospital. I work as an IV pharmacy technician. So we have to make sure that we are 6 inches into the hood whenever we are practicing our reconstitutions, whenever we are preparing drugs, because if we are not within 6 inches in the hood, improper airflow will reach our needle. And so we will not have proper airflow, which means that some particles could get on our needle, which means some particles could get into the bag, which means some particles could enter the patient's body, and that is not safe for obvious reasons. So you have to maintain 6 inches into the hood. You have to make sure that you are using the sterile aseptic technique. You have to make sure that you are not touching the needle, because the needle is a critical site. Whatever could be entering the patient's body is a critical site. So the needle that you're using is a critical site. Whatever you're puncturing with the needle is a critical site. The bag itself is not a critical site, because that could fall on the counter. It doesn't matter. The bag is not going into the patient's body. The medication in the bag is going to the into the patient's body. So those are critical sites. So if you see a fellow coworker drop their needle on the counter, because sometimes you lose control of the syringe when you are pulling up drug, and they continue to use the same needle, what do you do? So y'all can just leave me comments below in these scenarios and just let me know, what would you do? What's the right thing to do? Do you tell a supervisor? Do you tell the coworker, hey, you dropped the needle, you want to redo the whole thing? Like, you need to redo the whole thing. That's not sterile. That the counter could have had another drug on it. Now you have that drug on the needle. Now you're inserting that needle into the bag. Now that person has another drug that they were not prescribed into that bag. You don't know how that drug could interact with the actual drug that you have in the bag. Like, you don't know how those two drugs are going to intermix. You don't know how they're going to interact with each other. So what did you just do? The counter could have been dirty. You could have picked up bacteria on that needle, and now that you just injected bacteria into the bag. So what do you do? Or do you just not say anything at all? Because maybe that tech has been working there for 15 plus years, and you've only been working there for like maybe 8 months, and you don't want to come across like you know everything, or like you're better, or like you are trying to correct someone that's been there longer. What do you do, y'all? What do you do? So that's the first scenario. So let me know what you think, and I am gonna walk you into the second scenario as well, because I believe that the video did not start with me speaking about the second scenario. So your supervisor has assigned a group task to clean the IV room and has dedicated specific tasks to each individual teammate. However, only a select few of your teammates, including you, are willing to complete the tasks assigned. The workflow is too busy, and it will be impossible to clean the entire IV room while complying with the everyday tasks of preparing medication. So what do you do? A, tell a supervisor that your teammates aren't doing their job. B, attempt to clean the whole IV room with your dedicated teammates. C, only complete your assigned task and continue with your everyday tasks. Or D, call the group together to ensure that everyone is on the same page. This is the time when I'm going to go ahead and insert the video clip of me in the class, and we're going to go over what we think the class is going to give their input, what they think is the best decision. So let's hop right into it. Okay, so I'm seeing D and B. Now this is like a trick question, because there really is there's no right answer. I think you can do some of these things together. So yes, this has definitely been a scenario where I work at. Actually, it's pretty recent, because like I said, lately our workflow has been so busy. It has been every hour on the hour is something to do. Every hour on the hour. And it also depends on who you're working with, what other techs you're working with, because I'm telling you guys, like, that plays a huge part in how many things get done, and you know how on task you are. Do arguments break out? Things like that. So attempt to clean the IV room with your dedicated teammates. So like I said, there is no wrong answer. However, the IV room, whenever you're cleaning the IV room, in some hospitals, environmental services cleans the IV room. But in the one that I work at, we have to clean it. And it is a lot to clean. Yes, arguments are real. But it is a lot to clean. It's a lot to clean, and it's impossible to try to clean the whole IV room, because I guess I should have told you guys more information before I had just came out with the answer, or came out with like what I think. The IV room, when it comes to cleaning the IV room, you have to clean we have different vials that are in the IV room. Also, there's only a certain amount of things that you can have in the IV room, because you don't want to like have too many particles, I guess, or like potential particles in the IV room. So you can't have just like a lot of things in there. So you have to clean the buckets that come with things in it. So we have TPN machines. TPN stands for total parenteral nutrition, which is for people who can't eat on their own. So we give them like bags of dextrose, sterile water, different minerals and vitamins like calcium and sodium and potassium, so they can still have everything that they need. So we have those vials in the IV room, and we have to clean those vials. We have to clean the buckets that the vials come in. We have to clean the counters that the buckets are on. We have to clean the counter of the hoods, and we have about 5 hoods in there. We have to clean the counters. We have like 3 other counters that aren't part of the sterile hoods, that are just counters that we can set things on. We have to clean those. We have to clean the floor. We have to clean the ceiling. We have to clean the walls. We have to clean the inside of the hood. So there is like, you can open up the hood from under the counter. So you're doing your work on the counter, but like you can open up the hood under it, if that makes any sense at all. And you have to clean the inside of the hood, and you have to make sure that the hood is turned off, because I guess the hood spins on the hood doesn't spin, but in order for you to have airflow, you have like a spinner inside the hood, so you have to turn that off, and you have to clean that. And so it's very, very, very meticulous. Very meticulous. So the only reason why I would say that B isn't the best answer is because it's absolutely impossible. Like it's just too much to clean. It's just too much to clean. Now you can try to, but like I said, you have everyday tasks, and it's just too much. So there, like I said, there is no right or wrong way to do it. But I think that B probably would just be a little bit too ambitious. I think calling the group together is definitely a good idea. And honestly, I would even say that C, completing your assigned task. Like, completing your assigned task, but maybe calling the group together as well, would be a good option, because you want to be able to do your job and be able to have a track record. So a lot of times whenever they assign you cleaning and things like that, you will have to sign off when you did it, and just for record. And so that's good to be able to do your task, to say that you've done your task, and so you can have proof. But calling the group together is definitely a good idea. Now, this does not always work. Sometimes this results in arguments. Sometimes, especially if you're new like me, like I've only had about 8 months of experience. I'm working with people that are older than me, that have been working here for as long as I'm alive, as I've been alive, 23 plus years of experience. So if I were to call the group together and I'm like, oh, we need to do this, yes, my heart is in the right place. Yes, I want to have a clean IV room and be able to comply with my supervisor, but people may take that as a joke. Especially, I'm going to medical school. So that's another thing that people don't talk about in the pharmacy. If people see you going somewhere, or if people see you have other plans, they may have a chip on their shoulder when it comes to you. So anything that you do, they may not like it. Anything that you do, they may have a problem with it. So if you're calling the group together to ensure that you're on the same page, because your heart is in a good place and you want to make sure that everyone's doing what they're supposed to do without getting in trouble, they may not like that. They may start an argument with you. They may walk out. They may do what they want to do. So it's out of your control. That was a little too real, but it's the truth. And so that's things that you're going to have to just kind of deal with. And I think that's whenever your supervisor comes into play, because you want to do what's best for the patient at the end of the day. And you need to have a clean IV room for the patient, so they can be ensured, no infections or no, because these things can kill people. You don't want to do that. The patient is at the top of the priority at all times. So telling the supervisor is also a good idea if the group does not comply with you whenever you call them together, which is very possible that they won't. So on to scenario number 3. Okay, and this kind of goes into my my second scenario. You're working with a pharm tech that has worked 20 plus years as a tech. You notice that her technique is wrong when preparing an intravenous drug. Do you ignore it or address it? Y'all can put it in the chat whether you ignore or address. I want you to think about this, because I know y'all may think like, oh, this is like such an easy question. Of course, you should just address it. But I want you to think about whenever you've been a tech for so long, you really do learn a lot of things. And you kind of learn the ins and outs of things. You can learn different shortcuts. And I'll give you an example after you guys answer it. But it may be wrong to you because you're new. And you're working with a tech that has been working there longer than you have. So take into account what I just said and then answer, please. So for y'all that are saying ignore and address, tell me why. So I like Andy, address it, and maybe if what they're doing is faster and more effective, then you learn something new. Ask about her technique and figure out why she does that instead. That's good. Ignore, because that may be how she learned it whenever she or he first started working there. Good. I love these answers, because this has happened too. And I'll give you an example. So I appreciate techs that have been working for such a long time, because they know so much. Like, they really go unappreciated. They really do, because they know so much and they've learned so much. Address it. Maybe she'll explain that just because the technique is wrong doesn't mean it's wrong. Right. Exactly. So I'll give you an example. So I remember reconstituting a drug, and the drug needed to be reconstituted with normal saline. So, but the drug was also going in a normal saline bag. So I was reconstituting it, and I was adding normal saline from like a vial. Okay, I'm going to do my best to explain this. So I had a vial of I'm going to give you an example. So there's ceftaroline. Ceftaroline is it's a medication. And I was reconstituting it with a normal saline little vial. But after I reconstituted it, that vial was going to go into a normal saline bag. So I needed to reconstitute it with 10 mLs of normal saline, but it was going into an 100 ml normal saline bag. So I remember seeing a tech, they didn't even use the little vial of normal saline. What they did was they drew out 10 mLs of normal saline from the bag and reconstituted it into the vial, shook it up, let it settle, and then they just shot the vial of ceftaroline in the bag. So I was like, why are you not using the little vial to put into the ceftaroline vial and then shoot it up into the bag? And they were saying it doesn't matter. Like, if the ceftaroline needs to be reconstituted, and if you're using the whole vial of ceftaroline, you don't have to use a small vial. You can just reconstitute it from the bag, because the bag and the vial both contain normal saline, so it doesn't matter. So like, I just asked, and that's the thing, y'all. Like, ask questions. Always ask questions. Always ask an experienced tech. Always try to make friends with an experienced tech, because they can help you with a lot of things. And yes, y'all are all right. Experience teaches you a lot of things, and sometimes whenever you are busy, or not even whenever you're busy, but it's just good to like know how to do things in a more effective way and still get it done. So that's another example where I didn't need the 10 ml vial. It was easier to do that, to do it that way, and it was faster, but it was still accurate, and the pharmacist understood that. Another thing that I didn't really touch on, whenever you are a PHARM tech in the hospital, we just started working with this system called BD-Cato. Before we used BD-Cato, we were basically going off of an honor system. So whenever you make your drug, you have to make sure that the pharmacist sees everything that you are using. So if you used a 10 ml syringe, you have to show the 10 ml syringe. If you pulled up 5 mLs or 6 mLs of the drug, you have to push the syringe back to 6 mLs with the vial that you use of the drug. If you reconstituted the drug with sterile water, you have to write on the vial you reconstituted it with your amount, whether it's 10 mLs of sterile water or 10 mLs of normal saline. You have to write that on the vial so they know that's what you reconstituted it with. All your proof has to be with that medication. If it's not, you have to throw it away and do it again. Because the pharmacist doesn't know. They're not in there with us. Not all the time anyway. And even whenever the pharmacist is in there in the IV room with us, they're doing other things. They're checking medication. They can't watch us do it to see that we did it. To make sure that like, oh, okay, yes, I believe you. Like, no. Now, BD-Cato is a system that has a camera and a scale. Now, this ensures that we are doing the right thing. Because let's be honest, if without the BD-Cato system, I could be doing whatever and I could just pull it back to make it look like I did whatever, and the pharmacist wouldn't know. So that's not safe. Not that we would ever do that. Ever. I'm not saying that. But I'm saying the BD-Cato system makes it more trustworthy, and the pharmacist can actually see what we're doing because there's a camera. We have to show them what we're using, and there's a scale to make sure that we are pulling up the right amount of drug, that we are doing what we are supposed to do. So with the BD-Cato system, that really helps out a lot. And there are some drugs that aren't compatible with the BD-Cato system, so we do it, we will pull back the syringe and we will make sure we have all of our proof. But the BD system definitely does help us and help the pharmacists know what we're doing, making sure that we are using the right drug and everything like that. So back to what I was saying. Yes, y'all are right. Sometimes, 20 years ago, there are definitely different techniques than now. So that may be the way she learned it back then. But also, as you learn, even me, I've only been there for 8 months, but you learn different ways to do things. You learn different things. There was one time when I reconstituted a drug, and it actually needed to get sent out ASAP. And I accidentally reconstituted the drug with sterile water instead of normal saline. So I reconstituted it with sterile water, and I forget what happened. I forget what pharmacist checked it. But I think at one point the pharmacist was like, well, what did you reconstitute it with? And I was like, sterile water. And then I looked on, but after I did it, I looked on a sheet. We have a sheet that tells you the different drugs and like what you should reconstitute the drugs with and things like that. And so I realized that I was actually supposed to reconstitute the drug with normal saline, but I did it with sterile water. The pharmacist had already left the IV room to grab the medication. She had already left to run to whatever pharm tech was going to deliver the medication to the patient. So I was like, oh my God, I reconstituted with sterile water. I didn't use normal saline. Like, take it back, bring it back, bring it back. I need to redo it. I have to redo it. I don't want the patient. And so anyways, it turns out the pharmacist came back. And I was like, I reconned it with sterile water, not normal saline. She was like, oh, it doesn't even matter. And so she like walks away. So I'm like, what the heck? What do you mean? And so she was like, well, there are some drugs, and I'm not a pharmacist, so I don't know. But there are some drugs that can be reconstituted with sterile water or normal saline. It doesn't make a difference. So if you were a tech for a long time, you would know that. Now, of course, you wouldn't purposefully do that. Maybe it doesn't matter. I don't know. But the pharmacist said it didn't really matter, even though that's what it said on the sheet. So you learn things as you go. That was just my little scenario for that. You learn things as you go. So good job, you guys. So I have another scenario for you. This is my last one. I'm not trying to talk y'all's heads off, but this is my last one. And this is a good scenario. So you are delivering medication throughout the hospital, and you find yourself in a situation. You have a stat alteplase that is on the other side of the hospital. You also have 10 patients that have been waiting for hours on their insulin before they can eat. You are closer to the diabetic patients. Do you deliver the insulin first since you are closer, or do you deliver the alteplase? Just a little tip. Alteplase is used to dissolve blood clots and can be used to help a patient survive an acute heart attack, which is a myocardial infarction. Those are the same things. So what do you guys think? If you have 10 patients that cannot eat before they have their insulin, and you have their insulin, and you're closer to them, but you have a stat alteplase. Stat means they need it right away. No waiting. They need it right away. You have a stat alteplase. It's on the other side of the hospital, but if you go to the other side of the hospital, it may take you 30 minutes to be able to come back to the diabetic patients so they can have their insulin so they can eat. And you're already close to them. There's 10 of them. So there's a lot of them, and there's only one person that needs the alteplase. And they've already been waiting for hours. So what do y'all think is the best thing to do? Okay, so I'm seeing alteplase. I'm seeing a couple of insulins. I'm seeing alteplase. They would deliver alteplase because it's more important. Because it's stat. Insulin is important for patients to eat. Okay, diabetic coma, so that's something different. They have been waiting for hours. You are closer to them. Okay, so I'm gonna start talking about this. So I personally have not delivered. The only medication I've delivered is the remdesivirs to COVID patients. So typically I know I told you guys about the pharm techs that work in the oral medication side. I work in the IV medication side. So typically the pharm techs that work in the oral, they deliver these medications. Like the drugs that we make, they deliver everything. We don't deliver. We only deliver the COVID. We only deliver the COVID medication. So I have not specifically been in this situation, but this is very realistic. So you have a stat alteplase. It's on the other side of the hospital. You have insulins. And so you want to know which one do you deliver first. So you always deliver the stat medication first. Typically the stat medication typically the nurse will be waiting for it. You won't have to deliver it. If it's stat, somebody's coming down there to the pharmacy to get it. Like, they're not going to wait on you to bring it up. Or sometimes we'll tube it. So the hospital is so big that there's tubing stations where you put the medication in like a little plastic tube and you close it up. And basically there's different tube stations all around the hospital. So there's like tubing numbers. And like one tube number will correspond with like a certain hallway on the hospital floor. So you can tube it to station 410, and that's like maybe the 3rd floor. And then the 3rd floor nurse will come and pick it up. So I know that y'all didn't know that, and that's really irrelevant to this question, but that's just some extra information. So the stat medication always comes first, even if it was switched. Yep. Yeah, like it's perfect. Like the old school banks. Yes. Like whenever y'all go into the bank, or you driving through the bank and like there's a tube and you put like your check or whatever in and they tube it up just like that. So even if this situation was switched and you had a stat insulin, but you had like an alteplase, it doesn't matter that the alteplase is used to prevent a heart attack. If your stat is insulin, you deliver that stat. So the stat is what matters. Alteplase is important, but it's if the drug needs to be delivered stat, it doesn't matter what it is. It could just be a regular bag of normal saline. Like, it doesn't matter. If it's stat, it's delivered first, period. So I've seen some people say alteplase because it could prevent death and things like that. But if that insulin was stat and you have an alteplase that maybe you do 5 minutes after or even the same time, but it's not stat, you deliver that insulin first. Stat takes over everything, absolutely everything. And I did learn about alteplase. It actually comes frozen. We reconstitute it. We make the alteplase, but we have to draw it up in like syringes. And then whenever we draw it up in syringes, it goes into a freezer and it's frozen. It stays frozen. So we have to like thaw it out, which I thought was kind of cool because we have to thaw it out, kind of rub it up with our hands, or we put it under our like arm to warm it up. And then we kind of mix it with normal saline to make it liquidy instead of frozen. So these are the kind of problems that occur in the pharmacy that start in staffing. What do you mean?
So we had a scenario, we were talking about a scenario, which is a famous one that's connected to pharmacy law, where a technician made a bag for a baby and it was 23 times the saline concentration. Yes, now you all see the face she made. That's shocking. And the pharmacist sent it out and it went all the way to the baby, killed the baby. And the pharmacist went to jail. And we were talking about whose fault are problems like these. Should the pharmacist have gone to jail? What should have happened to the technician? And I was pointing out sometimes the problem in your pharmacy isn't that you're doing anything necessarily wrong. It's that you don't have time to address the problems that are in front of you. And sometimes the real fault is someone in staffing didn't put enough people on your shift. And you're working all day like, any kind of example from history. And it's because somebody's like, they don't need an extra 8-hour person, but you do.
That is perfect. That's perfect. Did they use I guess they used a 23.4 4 MEQ concentration instead of the regular normal saline? Because we have two different normal saline. We have two different sodium chloride vials. That sounds like what it is since it's 23 times, but I don't know. But yes, that is yes. And that's honestly, you guys, I want to be completely honest. You may come across some employers that make you feel unappreciated, and we do a lot of work in that pharmacy. Like, we do a lot of work. I didn't even talk to you guys about stock. Stock consists of putting together mini bags and vial mates. And basically what stock is you have different medication in the pharmacy, throughout the whole pharmacy, that can be used by the patient, and the nurse has to administer it. But some medication is just connected to a bag, and I should have like put pictures in here, but it's connected to a bag, and and the bag is connected to just a vial of medication. So instead of you reconstituting anything, you just have a bag of normal saline, and you have a vial that's connected to it, and they kind of just sit out. They sit out in the open, and sometimes you run out of those things, and you have about 2 bins of different drugs. Whenever you run out of one bin, they have the people in the IV room do stock. Stock just makes other bins of the same thing to make sure that you never run out. That way, whenever a pharmacist or a pharm tech needs that drug, or a nurse may need it, you slap the label on it. You slap a label, like if a patient needs it, you have the patient label. It has the medication, their name, their information. You slap that label onto that bag, and then the nurse just takes it and administers it, and it doesn't require you to reconstitute it or anything. The problem with this is stock. I have had personally 300 bags myself to make stock with, and I had to do it on my own. Now stock can be very hard on your hands. It can give you carpal tunnel. It can give you different types of symptoms, like just throughout your body, because you have to pound a mini bag. I can't wait till you guys just have your own experiences, but you have to connect a bag that has like a pointer, like a pointy thing inside of it, into the vial. The vial is like rubber, and it's hard. Not everything can get through it in order to ensure that you're being safe and it's clean. So it's like that for a reason. You have to break the seal, and so you have to break the seal with the pointy thing that is connected to the bag, and it takes a lot of force. And so I've had one time where I had to do 300 mini bags. I didn't even get done. I was doing for the whole entire shift. I was doing mini bags. I didn't have any help because they didn't schedule someone. And then it's like, okay, well, I want to get everything done, but I can't, and my hands are killing me. I only got done about maybe 180 bags out of 300, and I still had more things to do, because at that point the pharmacy was just getting so busy. I couldn't do it all. And normally they schedule someone with you because it's just harder to do by yourself. It's so much easier whenever you have a team. But at that particular point in time, they didn't schedule anyone to help me. So I was just doing that the whole time. And it's things like that people don't really speak about. We work so hard. I've never worked so hard in my life. It's very rewarding, and I've learned so many different things. But yes, it's so important to have help, and it's so important to work with a team that is helpful, that wants to help, that wants to be able to pick up where you lack, pick up where you, I don't want to say slack off, but just, it's so important to have a team environment. And yes, it is true, not everyone works at the same pace, not everyone works at the same speed, but it's just important to have that heart to help your teammates, because we're all working hard in here. We're all doing something. There was one, even yesterday, I wasn't in the IV room yesterday. I was doing something else that they needed me to do, but yesterday we had about almost 60 TPNs to make, and that's a lot. If you don't know anything about TPNs, just know that doing 60 TPNs in one day is a lot. Not taking into account that we deliver those TPNs. We're the only pharmacy that makes TPNs in Charlotte. So we have to deliver those TPNs to the university area, to the Pineville area, to the Cabarrus County. We deliver all those TPNs because we're the only ones that makes them. So it's stuff like that. Even if, and there are different tasks that you are assigned for that day. Everyone has their task, but it's so important to work as a team, because once your task is done, or once you have some downtime, that other person doesn't, and they're working. So in order to get everything done, it's so important to work as a team, and that does cause arguments as well, because not everyone works as fast, not everyone works as efficiently, and not everyone is meant to be in the IV room. I used to hear that a lot, and I thought people were being dramatic, honestly. I thought that, I'm like, well, if you can be trained, then you can learn how to be in the IV room. It's no big deal. Like, I don't think I am so for, motivating people to do whatever it is they set out their mind to do. And so I don't like when people say, 60% of you will fail, or 70% of you won't make it through college. I hate those stats, because it's like, what are you trying to do? Are you trying to discourage me? Can we please just hop on board and like be with what I want to do? Like, why can't we just work on this goal together? I don't like when people try to steer people away by being discouraging. I hate that. So whenever people say that, I would be like, okay, like, I just don't get it. Like, what's your point for saying that? If someone wants to be in the IV room, let them be in the IV room and train. If they can be trained and they can be coached, like, let them do that. What's the big deal? But now I can say, I understand that it's not, everyone is not meant to work in the IV room. It's hard work. You do have to do a lot. You have to do a lot of math too, as not as much as the pharmacist, but there were some times where, even a couple days ago, where I had to do some math when it came to I had to make a specific bag that contained heparin and sodium chloride and sterile water and dextrose. I had to make a big bag, and I had to do it a couple times, and it required a lot of math. So even then, like, it takes you have to think, and you have to be sterile. You have to be able to not multitask, but you have to be able to pay attention to what you're doing while you're doing it. And that sounds like it's easy, but whenever you have a needle in your hand, it's not. So it's not for everybody. But you will learn your way. You will learn your own path and what works for you. Right. It's about finding your fit. Exactly. So I used to not like that when people would say that everybody's not cut out to be in the IV room, because I don't like division and exclusivity, I guess. But it's really not even about that. It really does. It's not for everyone, and it is a lot of hard work, and it's really not for everyone. So, but it's very rewarding, and it is more meticulous than like the oral side. Like I said, I've learned so many things. I've learned so many things compared to like the other what am I trying to say, like retail pharmacy and assistant living. I've learned so many things. So that is basically it. That was all I have for you guys as far as my scenarios go. What do y'all have any questions? Or do y'all have any questions about my experience, or just scenarios in your head, or anything like that?
Will you talk to us a little bit about how you either transitioned or like simultaneously found a way to get to med school? I saw in your videos that you were worried about the MCAT, which everybody worries about, so that's very natural. But I know a lot of the students in this class, they're interested in pharmacy because they want or need a job, but they're also trying to move into more medical fields, and some of them are at the point where they should be filling out applications.
Okay, so you want to know you wanted to know basically my journey throughout getting to med school, or like applying and everything?
Yeah, kind of like, where did you get the idea, the nerve, the determination, the strategy? Like, what were the challenges from getting to, I think this is something I might want to do, to being on your way to being a doctor?
Okay. I would say ever since I was in high school, no, not high school, beginning of college, senior year of high school, I wanted to be a doctor. At first, I thought I wanted to be a sports medicine doctor, and I thought I wanted to actually perform surgeries on like ACLs and things like that. But throughout my college years, the thought of going to school for 4 more years, did kind of discourage me a little bit. So I was trying to work my way around it, and honestly, I was settling. Me as a person, I was just settling. I was thinking, do I want to do life coaching instead? I did do personal training. I also ran track at UNC Charlotte, so I know a lot about the body, and I was like, maybe I should just do that and be a personal trainer and just create my own brand and be a life coach. But I was like, at the end of the day, I'm not attaining the knowledge that I want to attain in order to help people, in order to teach people different ways of life, in order to teach people how to control their own health, and don't put it in the hands of a doctor, even though I do want to be a doctor. But I want to help people in that aspect, coming from a doctor, coming from what I will learn in med school, what I will learn throughout my experiences. So I knew that I couldn't do that without being a doctor, and I knew that I have such I have such a drive for knowledge. I love to learn. I love to ask questions. And I noticed throughout my experiences in college, I was a personal trainer, but I didn't really know how to answer certain questions. I didn't really know why this happens, or why does their body do this, or why do they feel this way, or what foods help this person, and how does it help this person on a biochemical level? Like, how does this work? What's better for this person because they have this body shape, they have this body type, or their genetics are like this. So how would this type of food be able to help this person and benefit them in the best way possible? I'm not going to know that if I don't go back to school. And that was what was getting me. I was trying to work my way through, maybe I should be a nutritionist. Like, I really was just trying to not tap into the doctor side, even though I knew that's what I wanted to do. But whenever I was about to graduate, I just had to be real with myself and understand that first of all, I'm a type of person where I want to dibble and dabble in a lot of things. I want to be a doctor, but I want to be so much more than that. And so the thought of going to school for 4 years, I felt as though I'd be putting my life on hold with just going to school and studying. And I also know that that's not good for my mental health, because I went through a semester in college when I was taking organic chemistry and physics in like a bio lab while I was running. And I just felt my mental health definitely took a hit. I didn't feel like I was myself. I felt like I was just doing the same thing over and over again. And that worried me, because I knew that in medical school it would be 5 times harder. I'd be being full-time as a student. But what it taught me is to have balance and to still find ways to do what I want to do, make time to do what I want to do. So that's kind of why I've created my YouTube channel, and I kind of just want to venture out and do different things. I'm not just a student, and you're not just a student. I'm talking to you guys. Like, you're not just a student. Don't be defined by what you do. And so that kind of made me realize, okay, you can be a doctor. You can do these things. You have to create time. You have to create balance for them. You have to understand that being a doctor, a student doctor, is your first priority, but you can do these things. So I say all that to say, I kind of always knew I wanted to be a doctor. I knew that I wanted to learn and be able to help people through what I've learned. And I want to be able, I don't know what kind of doctor I want to be yet, but I do know that I want to help people, and I want to use my knowledge to spew out knowledge to other people so they can help themselves. I think a lot of times, like, in the medical world, people don't trust doctors, or they think that, well, the doctor knows best. And it's like, but as a future doctor, I want my patients to know what's best. I want them to be able to take control of their lifestyle. I want to be able to give them options, but at the end of the day, they have to choose whatever, they have to make their own decisions. So I know that, and just throughout my experiences, I know that being a doctor is what I want to be. It's becoming more clear. Personal training wasn't fulfilling enough for me, and I love being a tech, but it's just not, it's not there for me. It's not, it's just these different experiences are teaching me that being a doctor is my road. This is what I'm meant to be doing. This is where my passion is, and I'm gonna find my direction in regards to my specialty in due time. But that's basically my story. I kind of always knew, and I originally was going to be a medical scribe, but that they wanted me to work full time during my season, and that just wasn't, I couldn't do it. And that's a con of being a student athlete, because a lot of times you don't have that time to get experience, because you're always on the track, or you're always going to a meet, or you're busy throughout the summer. So being a technician was easier for me, and I just applied to a bunch of different places, and it was easy. They got back to me, and I enjoyed it. And I can say that I have appreciated this experience. It's taught me so much. I know that pharmacology will be easier whenever I go to med school. And for all of you guys, if you're looking to go to med school or pharmacy school, this is going to be great for y'all. And I was going to say this too, and I'm trying not to speak, I can talk a lot, but I can say that there are some pharmacists that I work with that you can tell which pharmacist has been a tech before and which one hasn't. And I can appreciate the pharmacists that have been a tech first, because they know what the work is like. They know what the grit is like. They know what the ins and outs of every day is like. And some pharmacists don't. And I'm not saying that you have to be a tech in order to be a good pharmacist, but I'm just saying in this scenario where I work, I can tell who's been a tech. I can tell who understands like what it is, because some people don't. Some pharmacists don't, and some pharmacists just don't really appreciate what you do. They don't really appreciate what it is you do every day. They don't really care to understand it, and that could just be due to their personalities or whatnot. I don't know, but I can appreciate a pharmacist that has been a tech, and they understand and they know what it's like, and that just makes me like happy, because some people don't, and it's a blessing to be able to work with people that you get along with and that you can appreciate as a person. So that's basically my journey. I think definitely being a tech is helping me, and I know that it's going to help me in pharmacology, because for anybody that wants to go to medical school, you do have to take pharmacology. I don't know how many courses, but this will definitely help you in pharmacology, because you're gonna learn so many drugs and what they do, and you're gonna learn the prefixes and like or not the prefixes, but like the suffixes. Like certain drugs will sound the same because they do the same things. You will learn so many different things, and you're gonna appreciate it. So that's where I am right now, and I did take the MCAT. I don't know what you guys are specifically doing, but I am doing an MCAT giveaway. If any of y'all are interested, you should go check out my YouTube, because I have directions on how to enter the MCAT giveaway. I have 2 different sets of studying tools that I use, so I'll be doing 2 giveaways. If you guys need help studying, it's very hard, but you can do it. You can do absolutely anything that you put your mind to, absolutely anything. And just know that wherever you guys go, whether you go to pharmacy school, nursing school, medical school, whether you become a technician and you want to work as a technician, you will find your niche. You will find what's best for you. You will find what makes you happy. If there's a job that doesn't make you happy and it starts to wear down on your mental health, you have to find another job. I know we need jobs. I need a job. I'm glad I have a job. But it's so important to not put yourself in stressful situations and do what's best for you. Even if it's a school that you're applying to, if you feel as though that school may not be the best fit for you, or they're not as open to you because of this score, or you feel like it won't be a good environment for you, choose a school that wants you. Choose a school that chooses you. And you will appreciate that. It takes maturity, and it takes maturity is really what it takes. But at the end of the day, you don't want to just go to a school because of the name, or just because of whatever. You want to make sure that it is right for you. You don't want to choose a job. Yes, you need money, but I guess you get my point. I think it's important to really pay attention to the energy that you're around, and make sure that you are doing what's best for you. Make sure that you're doing what's best for you, because at the end of the day, you have to live with you. You have to lay down with you. You have to wake up with you, and no one else. So that is my journey, and we're still on this journey, but that's where I am.
Thank you so much. So I just want to give people another opportunity to ask questions. So we'll just wait another 30 seconds.
Okay.
I know some people don't want to ask questions because they don't want to turn their camera on. And there's a rule that I can't hear you if I can't see you.
Oh, okay.
But I do want everybody to give you a round of applause. So why don't we have like a camera-free moment, and we can clap, because that was a great presentation.
Thank you.
All right. Can we do that, you all?
Thank you.
Okay. All right. Well, can people email you with their questions after the class? Oh, no, they shouldn't email with your... Oh, Alexis has a guest, too. They shouldn't email you with your questions. They should go on your YouTube site.
Yeah.
To look how hip I am. And post the questions so you can get more.
Yes, more. Give me more. Yeah, so what I'm going to do is I'm just going to type in my my YouTube name, and I'm just going to type in the link. So y'all can just ask me whatever. I have videos. I'm going to keep making videos, keep documenting my journey, so it'll be easier on y'all. Hopefully y'all can like just learn from it, and it'll be easier for whenever you go through yours. So I have my...
Okay.
Oh, sorry. I was gonna say I have the link and I have my name. So.
Are there other questions? I saw Sin Lee had her camera off. I don't know if it's. Oh, I see Alexis. Do you have a question?
No questions.
Okay, you just wanted to see how cute your friend is. Okay, you all. Well, I don't know. I would come up with a question because otherwise it's gonna get real boring real fast. They want to. They're acting like they really want to hear about the history of pharmacy. I'm gonna let them have it. Thank you so much.
No problem.
Very much. Really appreciate it. Everything you said was very true, very real, very representative of what it's really like to be a technician in the hospital basement. And yes, we really appreciate. And I know you're busy because.
Thank you.
First of all, you talked about doing a million things. I know, given the things that you talked about doing, those things take hard work, effort, and you're right, to have that mental balance, that also takes time. So you have to take time to reflect in order to be successful at those things. So,
yes, ma'am.
We appreciate it.
Thank you so much for reaching out to me. I really appreciate it.
Oh, you're welcome. It was the best email chat I ever sent. And I definitely will send you a thank you via email just to, again, assert how grateful we are.
Thank you so much. Y'all enjoy the rest of your class.
Thank you.
All right.
Thank you.
All right, you all. We're going to take a 5-minute break, and then we're going to come back and wind up, okay?
Okay, that was my that was me meeting with a class. I met with a pharmacy class. Oh, whoops, let me not record this. So that was a pharmacy class that I spoke with. They are in the state of Chicago. And I was just speaking about my experiences as a tech because she's working with techs, people that may want to go to medical school, nursing school, be a pharmacist, or remain a tech. So I was just speaking with them. They were so nice, and I hope you guys learned something from this. I just kind of went over my scenarios that are very realistic for a person working as a pharm tech, and I just hope y'all enjoyed it. I hope y'all learned something from this, and don't feel free to give your girls a thumbs up. Thumbs up. Thumbs up. Subscribe, you guys. Subscribe. Please. Subscribe, and don't forget to comment. Let me know what you thought about this video. All right? I will see you in the next one.
I ran up a check, I might do it again. Enemies close, had me thinking they're friends. 10 toes down, I'll be free until the end. Crib outside the city, I don't feel safe in my hands. Took so many years, I'm just waiting for the wins.